Childhood depression. Just because a child seems sad doesn't necessarily mean he or she is in depression. It is different from the everyday emotions that occur as a child grows. If the sadness becomes persistent, or severe enough to interfere with one's ability to function, it may indicate that he or she has a depressive illness. More than 3 million youth between the ages of 12 and 19 are at risk for developing depression. Depression can have a devastating impact on children and their families. Depression in children may be as part of a medical condition like hypothyroidism or drug abuse. So, a detailed medical checkup is essential before labeling a child as depressive. Girls are more likely to suffer from depression than boys. This leads to more suicide attempts among girls, but boys are more likely to kill themselves when they try. Like many illnesses, several factors play a role in the development of depression. It often develops alongside with anxiety. Genetics plays a key role. Teens with a depressed parent are as much as 4 times more likely to develop this disorder. Children who have depression are those who have suffered other biological problems, like low birth weight, trouble sleeping, and having a mother younger than 18 years old at the time of their birth. Psychological contributors to depression include low self-esteem, negative body image, being excessively self-critical, and often feeling helpless when dealing with negative events. Children who suffer from conduct disorder, attention deficit hyperactivity disorder, ADHD, clinical anxiety, or who have cognitive or learning problems, as well as trouble engaging in social activities also have more risk of developing depression. Depression may be a reaction to life stresses, like verbal or physical trauma including sexual abuse, the death of a loved one, and school problems. Youth who are struggling to adapt to the school have found to be at higher risk for developing depression. According to Peter Gray, a professor of psychology at Boston College, school has become an abnormal setting for children, than labeling children as abnormal. Conditions like poverty and financial difficulties, exposure to violence, social isolation, parental conflict, divorce, and other causes of disruptions to family life can lead to depression. Children who have limited physical activity and are obese have an increased risk of developing depression. The symptoms of depression in children vary. It is often undiagnosed and untreated because they are passed off as normal emotional and psychological changes that occur during growth. In younger children, depressed mood is expressed as angry behavior. This is known as masked depression. But many children display sadness or a mood like adults who are depressed. The primary symptoms of depression revolve around sadness, a feeling of hopelessness, and mood changes. Significant appetite changes, with or without significant weight loss, or gaining excessive weight is common in children. A change in sleep pattern like trouble in sleeping or sleeping too much often seen in depressed children. Difficulty in concentrating with impaired performance of schoolwork. More risk-taking behaviors, showing less concern for their own safety. Thoughts of death or suicide. Increased sensitivity to criticism or other negative experiences, with crying more often and more easily. Young children may act younger than their age or than they had before, regression in age. Not all children have all of these symptoms. In fact, most will display different symptoms at different times and in different settings. Depression is not a passing mood, nor is it a condition that will go away without proper treatment. The role that family and the child's environment play in the treatment process is different from that of adults. A combination of psychotherapy and medication is most effective at treating depression. Regular physical activity not only improves a kid's physical health, but it might protect against depression as well. A review of 40 studies involving 90,000 children between 8 and 19 years old showed a strong bond between being more active and having fewer depressive symptoms. Having a solid social support and feeling connected with family and friends is known to have mental health benefits. Sufficient, good quality sleep is also known to improve a child's mood. Some people worry that talking about sadness or other symptoms of depression will make the problem worse, but that is a misconception. If you suspect your child might be depressed, the first step is to talk with him or her. Ask how they are feeling. Listen, and offer your support. Do not be afraid to consult your family doctor and ask for help. We know more today than ever before about the toll depression can take on children and adolescents, but there is still a lot of work to do. Thank you.